remember to enter your access code number and then press pound. To enable your audio, please enter your audio PIN. We will unmute you when we start the broadcast, so you will need to mute yourself to eliminate any background noise. Welcome to the All Children Thrive webinar. Today's topic, we'll be talking about the Bootcamp graduation presentation. Again, for today's call, we'll be keeping the phone lines open so that you're able to talk and ask questions. Again, please mute your phone line while listening. If at any time you have any technical difficulties during the webinar, please place those in the question box and we will work on those behind the scenes. Now I'm going to hand off to Sherry Wooten, who will go over our learning objectives for today.
Hey, Emily, thank you. And it's really simple. You all have worked really hard, and you have a boot camp presentation coming up for your projects. Some of you are doing it on June 19th, some of you on an alternative date. But we just want to make sure you understand the content that you'll be presenting and the delivery approach. And we're doing that by having a couple of recent graduates share with you how they did and leaving time for questions and answer. I think we'll go on to the next slide. One thing before I introduce Angela to say is that each of you have been involved and have had a coach. If that is not true, if you maybe attended boot camp and didn't actually follow through and do a project, this probably does not apply to you as much. I just want to make sure everybody knows who's here. But for all of you who followed up with did a project, had an aim, ran through it, had a coach working with you on that, this applies to you, and this is the last and final step in getting your boot camp graduation certificate. So Angela Mullins works with the Cincinnati Health Department, and she has actually been involved with All Children Thrive and increasing QI capability in a couple ways. She took boot camp like all of you did, but she also is now in our next step class, which is called Impact You. But she's going to present to you her boot camp project and how she scoped it. And Angela, are you there?
Yes, I'm here.
Great. I'm going to turn over to you.
Okay. Hi, everybody. So this presentation, if you'll notice, my name is not on this first slide, and that's because we were working with our team at Northside Health Center. So the leaders of that team were Rachel LaPrae, she's a registered nurse, and Crystal Duskin. And what we chose to work on was healthy teeth in that health center. So I guess we can move on to the next slide, please. So the background, what we did was we were looking to improve dental access and assessment for our kiddos. And the problem that we wanted to solve was dental resource insufficiency and getting parents to think about their children's teeth and dental hygiene. The population was our Northside Health Center patients, ages 1 to 5, and the global aim was to improve dental health for that age group. So if you see down there, it says previously we had no system for tracking dental pain and did not have age-specific and insurance-specific resources for our patients. So that was our main issue that we were trying to remedy. But one thing I do want to point out is we have dental providers in Northside Health Center, so this was separate from the dental provider services. This was for our primary care and pediatrics. The next one, please. So our aim was to increase the percent of patients ages 1 to 5 years old who are assessed for abnormal dental pain per parent report and offered dental provider resources at the most recent well-child visit. We wanted to increase that from 50% to 90% by November 22nd, 2016. Two of the highlighted key drivers that we had were to standardize the workflow for assessing dental pain during the well-child checks, and we also needed to standardize the documentation for the dental pain assessment. Next one, please. So one of the interventions that we tested was standardizing the documentation for the dental pain assessment. And what we chose to do was put it in the, I think it was in the vitals tab. So dental pain assessment, dental pain assessment will be documented in the vitals tab under pain, and that was in the Epic EHR system. And the measure would be, the dental pain assessment will be complete and documented correctly. The results from that test were that we adopted that assessment and the standardized documentation for the dental pain. So next one, please. So on this front chart, it's kind of small, but the first PDSA, it says we initiated the assessment for dental pain and the baseline data at 0%. And the reason for that was because we didn't have baseline data to begin with. So we started from nothing. And then PDSA number 2 was where we actually created and implemented, which was not on the previous slide, the dental resource handout. So that was something that we learned throughout the PDSA project. I don't know what the next slide is. I can't remember. Oh, questions and answers.
Yeah, taking questions and answers. The one slide that you might add after this one is just how you might use the QI tools and learnings going forward. So, but thank you so much, Angela. And that that's perfect. That is exactly, you kind of went over the key details, what you tried, what your results were. So let's open up on the line like questions for Angela. And I'm looking here and I'm just going to say names. You know, we've got a small group here. So Amy and Blair, you're there and you're unmuted, so you can just speak when you have questions. Caitlin, Christina, let's see, Kelly, Caitlin, Christina, Kelly, Ray, and Susan. Right now you're not on the phone, so if you want to speak, you have two options. You can use the audio information and dial in to the, put your PIN code in, or on the right-hand side of your screen is one of the drop-downs says questions, and you can actually type your questions in there. And we can respond to them using that. So you can either get yourself unmuted or not. Everyone else should be unmuted. So let's, first I'll open it up and then maybe I'll go around the room and make sure. So any first pressing questions for Angela or the team?
No, this is Amy. Not yet.
You're good, Amy. Amy, you knew I was coming to you, didn't you?
Oh, yeah, I've been there. Okay.
Yeah, great. Blair, any questions?
I do not.
Okay. And we'll have Leisha go. Hers is a little different. Angela's was more in a medical clinical setting, and Leisha's, you'll see, is more around relationships and social setting. Let's see, who else? So Caitlin and Christine, if you have questions or comments or just anything, you can put them in the question box, and we'll watch for that. Alicia, anything?
Nothing here.
Great. Jamie?
No.
Okay. Leslie, how are you doing? Any questions, or Tiffany?
Nope, no questions.
Anything in the question box? Okay, I may come to you guys and have questions for you. Let's flip back. Can we go through Angela's slides one more time? I just want to point out some things, Angela, I thought that were really helpful. So, kind of like that first background slide is it's where people who don't know your system or don't know anything going on, it's your chance to kind of help them connect in with what you're trying to do. So it's helpful here if you don't have a lot of your own kind of internal words and jargons, but just, if you were going to describe the problem to anybody, who would it be? So I quickly understand, like, oh, dental pain in children is not great, and there hasn't been a past system. So I'm oriented to where, then if you go to the next slide, how Angela, then it made sense to me, like what her aim was about, right? So I could connect those. We taught how to do key driver diagrams, and if you remember, they're a lot more complicated, right? Because our systems aren't going to be just two drivers. If you're presenting at the learning session on June 19th, this is more how we want you to have your slide, just because people can't see on a storyboard kind of format. They're not going to be able to see the detailed key driver diagram, but you can bring that with you as a handout. if you go to the next slide, so you can highlight one or two changes that you tried. Pick, you know, typically you've done way more than that in a 12-week period, but pick the one or two that you felt were most helpful, or that you want to show off, or that where you failed, because part of trying these changes is we learn quickly not to do that. So that's okay to have one where you abandoned it completely. And then the last one I'll go to, I think was your last one, was your results. You know, in this case, Angela had a lot of data, has a great run chart. Some people might be just trying to go from 0 to 5 people, but should still show your charts over time in some kind of a run chart or data. So Angela, thanks so much for that. I'll pause again and see if we have any questions in the question box or on the phone. Michelle and Emily, we're good on your side on the question box?
No, we don't have any questions in the question box right now.
Awesome. Well, let's have Leisha do her part then, and then we'll come back to any. Leisha, are you there?
I'm here.
Awesome.
We're
going to turn over to you.
Okay. Okay. So, that background picture says it all. Many barriers prevent Avondale children and families from thriving and reaching their full potential. How do I go to the next one?
Say next slide.
Next slide, please. These are my aims and my drivers. My aim was to meet all prioritized basic needs for 3 Avondale families by 11/22/16. We defined this as reaching a score of at least 3 on the Arizona Self-Sufficiency Matrix. Our population was Avondale families with newborns that were born at Good Samaritan Hospital and who are now CCHMC Pediatric Primary Care Center parents, and they were referred to the Legal Aid Society for legal help during their pregnancy. My highlighted driver is engaged moms that were willing to accept help for their social needs. That was really important. And then to have effective means of communication between the families and the PPC team. Next slide. So as it says, the driver was engaging moms accepting help for social needs. I tested an invitational approach where I approached the families and spoke with them about All Children Thrive and what we were trying to do. The mom agreed to work with us and identified her first prioritized need. My results was we adopted the invitation approach and included some assessments at the first meeting because we found out you didn't need to have a second meeting to do assessments. You could do it all at once. Next slide. So these are my measures and my results. I used the Arizona Self-Sufficiency score to determine their needs. As you can see, I have 1 through 5, 1 being not so good, 5 being empowered. And I did it bi-weekly. I tested with the families. The first family, I picked out her 3 basic needs were employment, food, and child care. So that's what I tracked on this one. For employment, mom wasn't working in the beginning, and we needed to try to help her with child care vouchers. So we applied. At first, her grandmother kept the kid for her, but the kid proved to be too much for grandma, so we had to apply for daycare vouchers through Jobs and Family Services. We applied, and she got approved for them and found daycare. So she went up to a 3, and then from a 3 to a 4. To a 3. She had daycare. She only wanted daycare for a couple of days a week, and she got that. Food was a problem in the beginning. She wasn't. She had food insecurities where the food SNAP benefits weren't lasting throughout the month. So we were going to connect her with an area food pantry. However, the uncle suggested having family dinners at mom's house every Sunday, and all leftovers were left there for her and the grandchildren. That took care of any food insufficiencies that she was having. Her employment, she wasn't working. Once the daycare went through, she went up to a 2. And Mom wanted only a part-time job. So whereas 5 meant empowerment, 2 was empowered for her because that's all she wanted was to go to a 2. I have a second family chart where the mom's primary needs were safety, childcare, and education. She started out at a 1 for safety. She had 2, an infant and a toddler that were sleeping in bed with her. That was an unsafe situation. So working with the PPC staff, I was allowed to give 1 pack and play out to Mom. But once I sat down and discussed it with the clinical director that Mom really needed 2, they gave us 2. So Mom went from a 1 all the way up to a 5. The children were safe. Child care became an issue because the boyfriend was watching the kids. And then he decided he didn't want to watch the kids anymore. He didn't like sitting at home. So we were able to get her daycare vouchers, and so she went up to a 3. She would have went higher, except the boyfriend came back into the picture and decided he would watch the kids again. Education for her was the last one, and at the time of this slide, it only shows that Mom applied. She said she wanted to get her GED. So I got information on the Don Community High School program for adults, and Mom got signed up and started attending. She is still attending the community high school through Don. Next slide. Oh, that's it. Any questions? I'm muted.
Yeah, you're good, Lisa. We hear you. We had a couple questions that came in while you were presenting, so may also have to do with the previous, and we'll try to answer those. Angela did have to step away. She actually stepped away from clinic for us, so big thank you to Angela for doing that. Ray, I saw the team responded to your question, but I thought it would be good for everyone to hear this. So do we want you as presenters to discuss how you develop the key drivers? And I do think that might be some of the back and forth in the conversation that you have as people are coming around with the faculty. So yes, is the answer. It kind of prompted me, Leisha, to something that maybe, if you go back to Leisha's aim and the 2 highlighted key drivers, Leisha, how, and I know it's been a while, but I've seen your entire key driver diagram. How did you narrow into these 2 to highlight here today? I know it's been a while, so it's okay if you say, but.
Well, the engaged moms had to be willing to accept help for social needs in order for us to move further, because that was my goal, to assist them to overcome barriers. So they had to be willing to engage. And then have an effective means of communication between the families and the PPC team. Like when Mom needed an additional pack and play, when only 1 is allowed per family. Through communicating with the PPC staff, we were able to break the rule and give Mom an additional pack and play, which put both kids in their own separate beds, making them safe.
Good, thanks. So it sounds like, and there's a few ways you can do it. For you, it sounds like one of these was the first step in my process. Like, I know that this driver is important, because if this doesn't go right, the rest of the process and what I'm doing won't go right. So that's one reason you highlighted. And then it sounds like, and I know this, and I'll interpret a little, and you correct me, Leisha, one of the most important things you found as you started to prioritize where breakdowns were is that, sometimes we had unwritten rules that could be broken, that wouldn't harm anyone and would be helpful. And you started seeing those failures a lot, and that is why that one probably moved up to your highlighted drivers out of your whole driver list.
Yes.
Great.
Any questions on the phone?
Yeah, this is Amy, and even though it's not on the slides here, but what were some examples of effective means, and you were just touching on that too, of communication between families and the team?
Basically,
that's not part of it.
It was knowing who to go to, who can make a change, who's in charge that can say, we can do this. And so once I connected with the clinical director at PPC and explained what I was trying to do, and what my problem was, then she was able to say, okay, we can go around that. We can make that happen.
Okay.
It's not something we can do every day for everybody, but in this instance, and then the other part to the communication was I met with my moms weekly. Every week, either via phone or most of the time I met them out in the community. I gave them an option not to have to come to me in the hospital, that I could come to them. So I had some visits in their homes. Some visits were like at the public library. Some we just went out to lunch and talked about what was going on, how they were doing. So that was my effective means of communication.
Okay. Thank you.
You're welcome.
Great, thanks. Emily or team there, any other questions that have come up on the question board?
This is Blair.
Okay, hi Blair,
Can you
go
hear me?
ahead.
Hey,
Yeah, we
it's
can.
not
Go ahead.
specifically about this, but it's so useful. I'm wondering if we could get a copy of these.
Yeah, let me clarify, copy of these example slides or copy of the recording, or both?
No, the slides.
Yes, definitely.
Oh.
Emily, will you reply and just send these out to everyone afterwards, or how will we do that so people know who to watch for?
I can send out the slides to everyone. That's not a problem. I'm also planning on including the recording in the bootcamp email for next week.
Okay, so two things. Emily Johnson will send you the slides, so watch for an email from her. And that was Holly. Holly, who sends that email? Because I don't think it comes from your name. Is it Community Health, or what does it say?
Yes, it comes from Community Health.
Awesome. So the weekly bootcamp email you've been getting from Community Health will also have that as well, is what you're saying, plus the recording, Holly? Okay, good. Blair, does that take care of that?
Perfect. Thank you.
Good. Good. Other questions, either in the question board or on the phone?
Gary, it looks like Alicia wanted to know what the astronomical data means.
Okay, Alicia, can you, I think we have you unmuted. Can you clarify more what you're asking there? Is it something we said in the previous presentation or in this one?
Yeah, it was on, I'm sorry, it was slow typer. The previous presentation, there was just on the run chart data points at the very bottom, and I think it said astronomical data. I could be wrong.
Let's go back and look at it. Yeah, I didn't catch that, but I know Angela's not here, so we may have to owe you that answer, but let's see if we can figure it out. If not.
Point, astronomical point.
Oh, that's a great question. I don't know what that means, and we don't have this in a control chart, so normally you wouldn't point that out, so we'd have to ask them what they meant by that.
Thank you.
Yeah, so Alicia, you were probably in our thing. We didn't spend a lot of time on this in our teaching, but it's like, this is a run chart. There is something called a control chart, and I'm trying to say this real simple. Statisticians would say this really differently than me, but at the end of the day, you kind of expect the data to act a certain way, and sometimes some of the points are outside what we call the control limits, so it means that they're outside the normal distribution that we would expect, so the chances that happens are like less than 1%. And I predict this team was kind of circling that because they feel like that was going on there, or maybe something weird happened in the system. What I will say is technically on a run chart you wouldn't point that out because you don't know that until you apply some statistical rules. And if people are curious about that, we can do some more teaching on it. We haven't taught that yet to this group. But so my prediction is they are thinking that this is a special cause. It's not normal variation. And your gut looking at that might tell you that's true, but you actually do need to apply some statistical rules before you ever point out one point on a run chart. Does that help a little bit?
Yeah, that's great. Thank you.
Good. And I may have brought up other questions for others, so let us know. And thanks for catching that. I had missed that. So. And then that's Leisha. Leisha has been great, and I'm hoping Leisha will help us coach next time around. So Leisha, I just want to say, I know Angela had to drop off, but thank you so much to you. I think Leisha at our upcoming learning session is actually going to be presenting more how she learns data. So if you, those of you who are coming to the June 19th to present your boot camp projects, there's a session right before that Leisha's doing around data. So if you'd like to see more around that, definitely join us. So I'll turn back over to you, team, about upcoming steps.
Okay, as Sherry mentioned, graduation for boot camp, and I know there's a few of you that won't be able to attend, but it is June 19th from 8:30 to 4 at the Sharonville Convention Center. From 10:40 to 11:40, you will share your poster during the storyboard session. They'll be hung on, we'll take care of having the tripod and foam board for you. We'll have tacks available so that you can post your slides. During this time, boot camp teachers will be circulating, and they'll be looking for your SMART aim, your KDD, your measure, PDSAs, what you learned and how you will use tools in the future. And then we'll come back together as a group in the main room, and we'll have reflections on the storyboards as a group together. And certificates will be provided to all the graduates. And we, as mentioned previously, we will make the slides available from the presentations today, just as another reference point to you as you're preparing. So if you have not registered, please register today. Email invitations were sent out on Wednesday, April 26th. Again, they came from the Community Health email address. So if you have not seen that, you may want to check your spam box for that email. And finally, if you cannot attend graduation, we are going to be having a separate event meeting for those who aren't able to make it. We realize this is a time of year for vacations and other things, so we will have a second option for graduation, and look for additional details in the weekly newsletter that has been coming out. Any final thoughts, Sherry?
No, let's just do one more pause. I'll just do the kind of teacher 10-second to make sure there's no questions on the phone, or to give you a second to type questions. So we'll just be comfortable with silence here for a moment before we go to our poll. Okay, it doesn't look like anyone's typing a question either, as far as I can tell. Guys, tell me if I'm not seeing it. So let's go ahead and kick off the poll questions. The first one's just our little gut at, I guess this wasn't an hour. Let's call it the 30 minutes was a good use of my time. So you can click the way it pops up right on your screen. You should click that. Oh, and if you are, remember to mute yourself if you're not speaking. Go ahead and just click your answer. Was this 30 minutes a good use of my time? And we'll give it, Emily, how are we doing?
We're at 82%.
That's pretty darn good. Let's give it a few more seconds just in case there's one last person figuring out how to get to the screen or click on it. Awesome. Let's go ahead and show. So just like we asked you to be transparent with your data, we're transparent with our data. So let's go ahead and show the results of this.
It's okay. You can tell.
Reminder to go on mute. We can hear some people talking. We have you unmuted, so it's a reminder to mute yourself. Great. So a range from, it looks like half of you were really happy you could attend. 40% of you said it was okay, and then 10% a little bit. So we like to hear from all three of you. Like if you want to put in the over where it's the question box, you can type in like why, what was useful, why did you click so glad I could attend? If you said it was okay, what could have made it bump you to the next one? And though it looks like one or two said a little bit, like what else would you have hoped to have heard from us today that would have bumped you up? that's all. We always consider those gifts, so thank you if you do go ahead and type further information into the question box. And as long as you just say send privately, we'll be the only people that see that. It's not going to go out to the whole group, so don't worry about that. And then let's do the next poll. This is just one last chance just to make sure if you have any last questions. If you say yes, we'll see it. It'll attach to your email and name, and we can follow up with you. If for some reason you couldn't today speak on the phone, or figure out the technical question box, or you just all of a sudden a new one came up. So if you say yes, we'll follow up in an email with you. If you say no, we'll consider that you're good and settled and know what you need to do for graduation. How are we doing, Emily?
Right now it's 80%.
That's pretty good. Maybe give them a few more seconds and then we'll share the results and do one last call for any questions or comments. Comments are always welcome too. Okay, so it looks like you all are solid and good, no follow-up questions. Any last comments or anything on the phone? Very good. Thanks, Ray, for the nice note in the comment box. And Alicia, thank you very much for that. And yeah, it was fun and glad. It sounds like you're all more comfortable with where you're going and you know how to reach us via email or through your coach. So thank you, everyone, and have a great day.